All good? Okay. Good morning. Thank you for joining us. And today I will just focus really on the situation of COVID, primarily in P.E.I, our recommendations for boosters, the vaccine, talk about some of the international travel requirements on testing, and also some advice around holiday gatherings and levies. In Canada, reported cases of COVID-19 were up slightly last week. The Western provinces noted a slight downward trend, with most provinces east of Manitoba reporting more cases. Unvaccinated Canadians were significantly more likely to be hospitalized with COVID-19 compared to fully vaccinated individuals. In the 12 to 59-year-old age group, unvaccinated people were 37 times more likely to be hospitalized with COVID-19 than fully vaccinated people. In the Atlantic region, there were 840 new cases reported in the last week, and there are 956 active cases. Today, there are 5 new cases of COVID-19 to report in our province, bringing our total number of active cases to 23. We've had 397 cases since the pandemic began. 3 cases are under the age of 12 years. 1 is in their 20s, and the other is in their 50s. 3 cases are close contacts of previously announced cases, and 2 cases are under investigation. Over the weekend, 3 cases related to École La Belle Cloche were announced. This situation is considered an outbreak, and now there are 6 cases related to that outbreak. In order to limit any further transmission and to allow time for testing, the school is closed for the remainder of this week, with students transitioning to online learning. The school will also undergo a thorough cleaning. Yesterday, close contacts of the École La Belle Cloche students were asked to be tested at one of the health P.E.I clinics. Individuals who were not close contacts, and were not symptomatic were asked to go to the pop-up clinic at École Belle Cloche. In addition, a child who attends the Eastern Kings Early Learning Academy tested positive for COVID-19, and the children and staff were tested yesterday. The center was closed yesterday to allow for testing, and I believe is closed again today to allow time for test results to be available and for cleaning. Over the last 4 days, we've tested over 8,000 people in P.E.I, including at the points of entry. Thank you to the students, teachers and staff, and other close and casual contacts who were tested over the last few days. Families and students at École La Belle Cloche, staff, and impacted sports teams and others who are close or casual contacts will receive an email with instructions regarding isolation and testing. Those families who are advised to follow the daily testing protocol can pick up their test kits at École La Belle Cloche today. We are concerned about the situation in Eastern Kings. There appears to be community transmission in that region of the province, as we are unable to link some of the cases to travel. In order to help us determine the extent of transmission in Eastern Kings, there will be additional access to COVID-19 testing tomorrow and Thursday. The clinics will be located in Surrey, at the Surrey Hospital on Wednesday, December 8th from 12 noon till 3 p.m. and on Thursday, December 9th from 10 a.m. to 3 p.m. Please bring your health card with you if you have one. Specifically, the following individuals are asked to be tested. All children aged 5 to 11 years, as they are not yet fully vaccinated, regardless of symptoms. Anyone in Eastern Kings who is involved in organized sports, regardless of symptoms. And anyone in Eastern Kings with symptoms, and I'll repeat, any symptoms of COVID-19. Anyone in these groups who has been tested in the last 48 hours or who is on a testing regimen or protocol because they are a close or casual contact of a positive case, they do not need to have or undergo additional testing. Eastern Kings refers to Mount Stewart, Morrell, St. Peters, and Surrey areas. I urge all individuals in these groups to please arrange to be tested at the Surrey pop-up clinics tomorrow or Thursday. Widespread testing of key groups will provide us with valuable information regarding the extent of transmission and what, if any, further steps need to be taken to reduce the transmission of COVID-19. There's one additional public exposure, the Eastern Kings Sportsplex, 203 Veterans Memorial Highway, Surrey, on Saturday, December 4th, between 8:45 and 10:15 a.m. Anyone who is at this location at those times and is not fully vaccinated should visit a drop-in testing clinic as well to be tested and monitor for symptoms for 14 days. And anyone who is at this location and is fully vaccinated certainly should monitor for symptoms for 14 days from the date of exposure. As of Saturday, December 4th, 94.8% of island residents aged 12 and over have received at least one dose of vaccine, and 91.4% are fully vaccinated with 2 doses. The vaccine rollout for children aged 5 to 11 is going well, with 15.4% of children in this age group receiving their first dose. It is positive to see such strong early vaccine uptake in this age group. Last week, 5 to 11-year-olds received most of the first doses administered. There are 2,300 appointments booked for children aged 5 to 11 years leading up to the holiday season. Many of the appointments at the Charlottetown Clinic are booking very quickly. However, there are appointments available in O'Leary, Summerside, Montague, and Surrey. Last week, NACI updated the national guidance on booster doses for adults. It is recommended that anyone age 18 and over get a booster dose 6 months after their last dose of COVID-19 vaccine. Some individuals are at higher risk of having severe outcomes related to COVID-19, including hospitalization. I strongly encourage anyone who falls in these groups to get a booster at 6 months. People age 50 and over, individuals living in long-term care, community care facilities, and anyone who is moderately to severely immunocompromised. Healthcare workers should prioritize getting a booster dose when they are eligible to protect themselves and their patients. Getting a booster is important for everyone and will help to protect you and your family from COVID-19. Last week, 30% of all doses administered were boosters. More people will become eligible for a booster as more people reach the 6-month mark after their last dose. For example, people who received their second dose in June are eligible to get a booster in December, and those who received their second dose in July are eligible for a booster dose in January. It is important for Islanders who are eligible for a booster to make arrangements to get their third dose. Getting a booster is important and will boost your immunity and help to protect individuals against severe outcomes from COVID-19. Anyone who wants to plan ahead to schedule their booster dose can do so 4 to 6 weeks in advance online using Skip the Waiting Room, or connect with a participating pharmacy via the COVID-19 webpage to find out about clinic availability. Last week, we announced new temporary measures in response to the Omicron variant of concern. Specifically, effective on December 3rd until early January, the following measures will be in place. Anyone arriving in P.E.I. from an international destination, including the United States, must be tested at the point of entry on arrival and again on day 4. The testing on day 4 is no longer recommended, but is required for these individuals. Individuals who arrive in P.E.I. from international destinations who do not get a 4-day or day 4 test will be subject to enforcement measures. Any individual who returns from international travel is unable to enter a long-term care or community care facility in P.E.I. until they've had 3 negative COVID-19 tests on days 0, 4, and 8. This applies to all visitors, staff, and volunteers. Similar to Nova Scotia, children under the age of 12 years are unable to travel interprovincially for the purpose of participating in sports tournaments or arts or culture events. P.E.I. cannot host interprovincial tournaments and arts culture events for children under the age of 12 years. Provincial tournaments within P.E.I. and arts and culture activities are permitted, as are provincial and interprovincial sports tournaments for those 12 years of age and over. These measures are in place until early January and will be reevaluated at that time. These measures are temporary, providing additional layers of protection to further safeguard the health and safety of islanders, especially prior to the Christmas and holiday season when people are getting together with family and friends. We've had a number of questions regarding holiday parties and levies over the season ahead. Workplace and holiday parties are considered organized gatherings and must follow appropriate public health measures. Levies are not recommended as they are high-risk events that includes close contact between multiple individuals and shared food and drink. However, if a group or organization decides to host a levy, it should be a VaxPass event. Similar to last year, outdoor activities are safer than indoors, and smaller gatherings pose less risk compared to large ones. It is important to assess our own risk when deciding to attend any holiday gathering. We should consider our own vaccine status, our own health status, and that of others. We should consider our risk of serious outcomes from COVID-19 and the risk to others, and also consider the type of activity. If we are not comfortable to attend gatherings over the holidays, it is important that we all support each other in those decisions. We really need to be careful and cautious and consider others around us. We also need to consider wearing our masks. They are required in indoor public places. And when we speak about masks, masking guidance was recently updated on the provincial website, and the effectiveness of non-medical masks depends on the material, construction, fit, and appropriate use of the mask. It's most effective when worn properly, covering the nose and the mouth. Generally, a medical grade mask is recommended, or a non-medical mask made of at least 2 layers of breathable and tightly woven fabric, an effective middle filter layer. We have been struggling to get COVID-19 situation here in P.E.I. under control since mid-November. Since then, we have reported 69 cases, and this represents really 17% of our total cases in the last 3 weeks since the pandemic began. I do believe our high rate of vaccination does provide protection against serious illness and hospitalization. We had, as one of our team members pointed out, in many ways, because we've had sustained activity over the last couple of weeks in P.E.I. with COVID, in many ways this is our first real wave of COVID. This is not the situation we want to be in as we enter the holiday season. COVID-19 is circulating in the province. This virus continues to spread and move when people move. I urge all residents of P.E.I. to pay extra attention to the public health measures. Get fully vaccinated, and if you are eligible for a booster, please book your appointment. And unless it's essential, do not travel off-island if you are not fully vaccinated. And if you travel off-island, be sure to follow the testing protocol when you return. Get tested for COVID-19 at a drop-in testing clinic if you have any symptoms. If you're not feeling well or have any symptoms of COVID-19, do not go to work or public events or gatherings of any sort. Public health measures of wearing a 3-layer mask when in indoor public places, washing your hands often, physical distance from people outside your household, and keeping your circle of contacts small. As we continue on this very tiring, weary, and painful journey of COVID-19, let us all together try to remember to be patient and be kind. Thank you. So I'll open it up to questions. So I know in the room, we'll start with Allison Jenkins from The Guardian.
Are the Eastern P.E.I. cases related to the Prince County cluster? And is there an update on the Prince County cluster of cases?
So we've not had any new cases related to that particular cluster for the last, certainly last few days, or since sometime last week. So I think the update is I think we're almost, from a timing point of view, we can be more comfortable with that outbreak, and probably we're able to get our arms around that. At this point in time, we have not established any link between that outbreak and what we're seeing in Eastern Kings, but again, it's pretty early at this point in time.
Yeah. And so Vax passes are going to become, even more important as holidays come and as the COVID activity continues. Has there been much enforcement activity about Vax Pass events, particularly restaurants, for example? Anybody getting in trouble for that?
So good question. I didn't bring the enforcement numbers, and we certainly can follow up. We have been trying to address any complaints or concerns that have come in. But I think in general, there's been really good compliance, and if there are concerns raised, it's often a reach out to a business owner, and education really being the first component of that. But I think in general, it's gone very well. But if there's been any recent enforcement update on those Vax Pass, I certainly can follow up with you.
I do have one more question. The provincial courts, courts are closed in Charlottetown. Just wondering if that is considered a public exposure, or if we can.
So at this point, it's not considered a public exposure based on the information from late last night, but there is additional testing being done for certain staff at that location, and we'll certainly learn more as those test results come in.
So workplace exposure, I guess now? Is that what you would call it?
So when we for any case, we talk to the case and the workplace around where they were, what they were doing, if they were distanced, if they had masks on, length of time exposed to anybody else. So that's all part of the sort of risk assessment that goes into it. So it would certainly, there was an exposure at a workplace involving certain staff.
Thank you very much.
You're welcome. Brittany from CBC.
So my questions are about the outbreak in Eastern Kings. I'm just wondering, you mentioned community spread. I'm wondering how concerned you are at this point about, I guess, the province's ability to sort of get that situation under control.
Well, I think, as I mentioned, I am concerned about what we're seeing in Eastern Kings. I think a couple of things. I think that making sure that there's some testing availability in that region is really important, because I'm worried that there may have been those who may have had symptoms in that area that found it challenging to get to Charlottetown or to Montague to a testing clinic. So I think it's important that people do get tested. I think it's also important to mention that if people are having symptoms, those rapid antigen tests, we've said right from the beginning of the pandemic, they don't have the same sensitivity. They really shouldn't be used if people really have symptoms, and if they have one mild symptom, a rapid antigen test should be repeated. And so I think those are some sort of general messages, but I am concerned, and I'm taking, I also know we have a very well vaccinated population, which should limit the spread, but we're certainly seeing, that's why there's a focus on the young age group as well. And I think it's not what our team, it's not what public health, it's not what health P.E.I, it's not what the community wants to deal with right now, having come so far in this pandemic. So we've had success before when we've done really sort of focused testing in areas. We've done it in Summerside, we've done it here in Charlottetown with certain age groups when we've needed to over the last year and a half to 2 years. And I think it's important if we can do some really broad testing of anyone who has symptoms up in that area. That age group 5 to 11, the organized sports, I think we'll see if we can really do some big, sort of that broad testing, which will help us identify people and then and try to limit it.
And so you mentioned, I think you said there were 6 cases related to that Surrey outbreak at this point. What would circumstances have to look like for circuit breaker measures to be implemented? Let's say, a pause on organized sports or anything else like that.
Well, certainly, I mean, it was discussed this morning what that would look like. I'm hopeful we don't have to do that, but I think the first step is certainly trying to do the testing and make that testing broad enough that we think we can not just do students at one school, but there's so much in all our communities here in P.E.I. There's so many interactions between different schools, between different sports, and I think it's important to at least start with that broader testing. And as we're going into the holiday season, certainly we don't want to put a circuit breaker measures in place if we can avoid it. We're just trying to protect those, protect people who haven't been fully vaccinated, who can't be fully vaccinated for any number of reasons. We don't want to have people end up in hospital. We see that happen in neighboring provinces. And we want to minimize the number of people who get COVID because we know that a certain percentage will also end up potentially with long COVID or symptoms that last a bit longer. And so Islanders have been absolutely amazing throughout this whole pandemic. No one wants a pandemic. We all want it to be over, and we are getting there. And when you think this time last year, there was no Atlantic bubble. Anytime we traveled off island, we had to isolate for 14 days. So we are in a very different position. We have majority of our islanders who are eligible, who are vaccinated, I mean, high percentage. So these are all really good things that mean that we should not have to do the same kind of circuit breaker measures. But we definitely want to make sure people have access to testing so that they can we can identify the cases and limit the further spread.
And how long will those testing clinics, those pop-up clinics, be available in Surrey?
Well, Health P.E.I., when we spoke to them earlier today, agreed to the testing clinics on tomorrow and Thursday, and I think they're trying to respond as well. So I think at this point in time, I only know about those 2 days, and really it's trying to get as much done as we can in the next 2 days. But I think ongoing, we'll need to try to figure out if access to testing, if people have symptoms delayed some of the initial identification, then we'll have to figure out how we can work with that community as well.
Right, and you sort of touched on it that, there were concerns that there could have been people who did have symptoms and didn't make it to a testing site because it was too far, they didn't have access. Will that change how, the province approaches setting up testing sites in the future?
Well, I think it's a challenge because there's only so many resources, and Health P.E.I. and EMS support has always been tremendous at responding to the need, wherever that is, whether it's in O'Leary, whether it's in Summerside, whether it's here in Charlottetown. So they've had to respond to where the need is, and it's not there all the time. So I think we'll continue to have those discussions with Health P.E.I. and they've always been able to respond as needed, but trying to balance where the testing is needed the most at that particular time, and it's hard when they get pulled in all sorts of directions.
And I just have one last quick clarification. I was wondering if you can clarify if teams under 12 who played against Eastern Kings teams, should they be tested as well?
At this point, any teams that are identified having a contact with a case, public health is following up with those teams, but we're not at this point doing broader than that at this point in time. But if there are certain teams implicated because of positive cases, we'll be following up with those teams directly.
Thank you.
You're welcome. Okay. Hello, bonjour.
Bonjour, Dr Morrison. Tout d'abord, en français, quelle est la situation principalement à l'école La Belle Cloche et du côté de Souris, s'il vous plaît?
Bonjour. Alors, à l'école Belle Cloche, il y a 6 cas qui sont liés, vraiment un outbreak à l'école, qui a commencé à l'école. On sait qu'il y en a, les étudiants qui sont là. Mais on s'inquiète que c'est pas seulement à l'école, que c'est plutôt dans la communauté. Alors, on demande que les jeunes à 5 ans, 11 ans, les personnes qui participent au sport et les autres activités organisées, et n'importe qui, quel âge, qui ont des symptômes, doit aller se faire tester demain ou jeudi à Souris pour qu'on sache vraiment le nombre de personnes peut-être qui sont impliquées. Et on s'inquiète un peu parce qu'on voit que c'est pas juste seulement lié au voyage qu'on peut identifier. Et maintenant, c'est pas seulement l'école. Alors, on s'inquiète un peu, mais il faut qu'on en fasse plus de tests pour voir combien de personnes qui sont impliquées.
Pour l'instant, l'école est fermée, le centre scolaire communautaire, la garderie, tout est fermé pour la semaine. Est-ce que vous pensez déjà à demander à ce que ce lieu soit fermé pour plus longtemps qu'une semaine?
J'espère que non. On sait si c'est possible et puis si c'est possible, on veut que les jeunes peut-être retournent pour la dernière semaine de l'école. Mais on va voir les résultats des tests. Il y a d'autres tests le jeudi aussi pour un grand nombre de jeunes. Alors, on va voir, mais j'espère que non. Mais on va voir.
Britney mentionnait ça par rapport au circuit breaker. Qu'est-ce que ça va prendre pour que vous mettiez en place des mesures coupe-circuit du côté de Souris?
Oui, et puis je sais qu'on va parler à l'épidémiologiste sur notre équipe aussi, mais on regarde pour le nombre de personnes, mais aussi si on a des personnes qui sont à l'hôpital, la capacité de santé publique et capacité de santé en général pour prendre soin de tous les gens. On va regarder dans quelles régions on ne veut pas que il y a des cas dans les soins des foyers de longue durée. On veut s'assurer qu'on limite la transmission. Alors, on va regarder toutes ces sortes de choses vraiment et j'espère qu'on va pas avoir un circuit breaker, mais on discute un peu, mais on sait aussi qu'il y a tellement de gens qui sont vaccinés à l'hydroprésadouar. Alors, ça nous protège. Je vais juste... j'ai un numéro ici que peut-être on doit mentionner. On a 132... Plus que 132 000 insulaires qui sont vaccinés à l'hydroprésadouar. Et puis, de cette groupe, 0,06% qui sont diagnostiqués avec COVID-19. Alors, on sait que ça réduit la chance tellement. C'est normal qu'on voit plus de personnes qui sont vaccinées qui ont COVID parce qu'on a plus de populations qui sont vaccinées. Mais vraiment, la pourcentage est tellement bas si vous avez COVID-19, si vous êtes vacciné que vous avez COVID.
On parlait des tests, vous invitez toute une région à aller se faire tester le plus rapidement possible. Est-ce que des cliniques vont être mises en place à Souris? Est-ce que ça va rester? J'ai cru comprendre qu'il y avait des tests qui étaient faits aussi à l'école directement.
Oui, il y avait des tests qui ont été faits à l'école Belle-Cloche hier et je pense aujourd'hui aussi, mais les autres tests pour demain et jeudi sont à l'hôpital à Souris. Et puis, on va discuter l'accès en général après les 2 prochains jours parce que c'est important que n'importe où à l'île du Prince-Édouard, si vous avez des symptômes, il faut aller être testé.
Dernière question pour moi. Vous avez annoncé des mesures pour les voyageurs internationaux. Est-ce que c'est la dernière étape avant d'annoncer des mesures pour les insulaires? S'ils vont à Noël à l'extérieur de la province et qu'ils rentrent, est-ce qu'ils vont devoir s'isoler? Est-ce que vous réfléchissez à ça?
Non, non, je pense pas vraiment. La décision pour les voyageurs les États-Unis ou internationaux sont vraiment en réponse pour le Omicron, le variant Omicron. Et puis, je sais, ils vont faire aussi tester par le gouvernement. Ils vont être directés au gouvernement fédéral aussi d'être testés. Mais je pense que c'est important. N'importe quoi, même si vous voyagez domestique, il faut avoir un autre test. On recommande un autre test, même ici. Mais pour les voyageurs qui sont hors de la qui voyagent hors du pays, c'est vraiment, il faut en faire maintenant, le 10e test.
Merci.
OK, merci.
CBC. Hi, Dr. Morrison. Sorry, I'm getting a bit of feedback on the phone line here, so I hope you can hear me okay. Can you go over the booster shot guidance again? I think there's been a little confusion. When should people be booking their appointment, and why isn't there more of a staggered approach like we've seen before? I mean, the guidance is sort of 18 and up now, which is just every adult on P.E.I. You mentioned the priority groups. They were already supposed to be getting vaccinated. It's been lowered to 50, I believe. But because certain groups were vaccinated early, 18 to 29-year-olds, because there was an outbreak at that time, that moment in time, they might be getting their booster shots ahead of some older islanders who didn't receive their second shot until, later in June, let's say. So I'm just wondering how the priorities are being organized, given it's sort of just wide open now. You just have to wait the 6 months after your last dose.
Well, hi, Louise. So I'm glad because if any question on boosters sort of highlights the importance that we want to make today about the boosters. So the staggered approach really is a fairly, it's almost inherent because we have so many of it was based on age primarily, but we definitely, so the 7-year-olds, my mother would, she was asking me the same thing. Her second dose was the 3rd week of June. I told her, why don't you book now, and then you can get your appointment in a couple of weeks. So we know that there's a 6-month window, and we have now over 50% of those 80 years of age and eligible who've already had their 3rd dose booster, and we're hoping that by the end of December, certainly that percentage of 70-year-olds also will continue to increase. As you point out, there were a small number, approximately 2,000 young people who may have had their 2 doses of AstraZeneca. They are recommended to get, and they had their AstraZeneca early, and it's recommended that they get an mRNA booster 6 months after their initial series if they've had AstraZeneca, and that's already been announced. The other group that may not be in the, from an age point of view would be some of our essential workers that were done fairly early on, those who worked in meat packing processing, some of the plants, our firefighters, and they will also be encouraged to get boosters. So it's, I think we I think it's important that anyone with a recommendation certainly goes ahead and starts to book their appointments when they're eligible. We have, it's a strong recommendation from NACI for those 50 years of age and up. It's more of a discretionary recommendation for 18 to 49, but it will, I think that from a P.E.I. perspective, if it's been 6 months since your first series of vaccine, then you can get vaccinated, and they're taking appointments for everyone to get in there.
Sorry, I think you just cut out there. I hope I'm not interrupting. So thank you for that. That is much more clear, at least to me. I also wanted to ask about public and flight exposure notifications. Lately there's been such a large number of those, and I'm wondering, now that there's a requirement to say be vaccinated to fly, for instance, some provinces have stopped issuing flight exposure notifications because the risk is considered so low. P.E.I. is continuing to do that. Is there any view of stopping releasing the flight notifications?
Louise, we actually have talked about that and discussed it with the epidemiologist as well. Some provinces are still doing their own flight notifications. At this point in time, we have continued to do that, knowing that a lot of there'd be passengers coming in internationally as well as domestically, and it's just a good reminder. The flight notifications may make people even just think, oh, well, if I'm having some symptoms and I was on that flight, maybe I should go get tested. So some of the messaging is the same. We may move away from that at some point. I mean, that will certainly be where we'd like to get at some point in terms of by the springtime, hopefully it'll be more messaging around only if you're ill, get tested. So we're going to get there, and that would mean fewer public notifications. But we've also, I know our friends in the media are also if we aren't doing public notifications, I think you're also asking why we're not. So we're trying to continue with this approach at this point in time, and we know that as our vaccinated population increases, we're going to have some more people who are vaccinated who still have COVID-19. We know we get almost an equal number of people even that test at point of care at the airport and the bridge. Our numbers are both the same in terms of how many people we pick up at those points of entry. So long answer, Louise, sorry, that we have discussed our approach to flight notifications. At this point, we are continuing them, but at some point, we may stop.
Thanks. Yes, the media always wants one thing or another, right? I wondered if, to your knowledge, has there ever been a case on P.E.I. or someone catching or getting COVID from an exposure on a flight or from public exposure locations? And we've been talking about, the risk from, say, inanimate objects, if you're not a close contact. How high is the level of risk when there is a possible exposure, say, at a grocery store or a restaurant or a gym?
So there have been transmissions related to public sites, but it's not necessarily related to the fomite transmission. I think we've learned that there's probably less fomite transmission than we may have thought back in March of 2020. But one of the things about public exposure notifications is that sometimes it's difficult to assess, were people really wearing their masks, both the case and the other people around them. For instance, maybe there's, they took their mask down and and coughed, and the other person didn't have the mask. So some of those things are difficult to assess, and that's why, again, what's changed about our public exposure notifications is really those who are fully vaccinated, we are just telling them to watch for symptoms, and then if you have any symptoms in the next 14 days, make sure you go get tested, and don't assume it's another kind of cold that your kids have or something like that.
But thanks very much.
Okay.
Thank you.
Marie-Emma Paronto, Radio-Canada.
Oui, bonjour. Merci pour les réponses en français. Concernant à l'école La Belle Cloche dont vous avez parlé tantôt, est-ce qu'on sait environ le nombre de tests qui ont été faits hier? Est-ce qu'on est content de la réponse des adultes et des enfants? Là?
Bonjour. Oui, je n'ai pas le numéro exact. Peut-être, je dis ça, mais non, j'ai pas le nombre de tests qu'on a fait, mais on peut identifier toutes les listes de personnes qui sont les contacts et on peut s'assurer qu'ils sont on fait tester, et puis s'il y a quelques-unes, on peut les appeler encore pour s'assurer qu'ils vont faire un test. Je sais qu'il y avait à peu près 280 personnes identifiées comme contacts à l'école Belle Cloche et aussi le Early Childhood Center. Alors, j'imagine que la majorité de ces contacts ont fait tester hier.
Parfait. Est-ce que vous avez aussi dit là, un petit peu plus tôt, c'est juste pour une précision, qu'à Lille, on avait un petit peu de difficulté là, à avoir un peu le contrôle sur la situation depuis la mi-novembre. Vous avez parlé du nombre de cas que vous avez eu depuis la mi-novembre. Est-ce possible de revoir ce chiffre, s'il vous plaît?
Oui. Il y en a... je sais que je l'ai ici, juste une minute. OK. Je m'excuse. Je sais que je pense que c'était 60... je l'ai dit en anglais, mais maintenant, je peux les envoyer, mais je pense que c'est depuis le mi-novembre, c'est la majorité, 17% de notre cas depuis mi-novembre, dans les 3 semaines passées, c'est 17% de notre cas en total.
Parfait. Et dernière question.
Je m'excuse, je pense que c'était 69 cas.
Ah, merci beaucoup.
Okay.
Dernière précision, juste parce que mon collègue vous a demandé et ça l'a coupé un petit peu, concernant encore à l'école La Belle Cloche, est-ce que vous avez dit que vous allez réévaluer au courant des prochains jours si l'école va ouvrir lundi?
Oui, c'est exactement ça. J'espère que ça va ouvrir, mais on va voir les résultats des tests vraiment jeudi et puis ce qui arrive dans la communauté.
Je vous remercie beaucoup.
Brian Higgins, CBC.
Hi, Dr. Morrison. I'm interested in the case at the Charlottetown court buildings. Are you able to share what type of work this person did at the courthouse? The reason I ask is I'm wondering if there's any risk of exposure to inmates at the jail or the or the public at large?
Hi, Brian. So, as with all our cases, there's a risk assessment done based on the history that we get both from the case as well as the workplace. And there is, at this point in time, no risk to any of anyone identified at the provincial correctional facility, and we have been in communication with them.
And the media release mentioned a high vaccination rate among court staff. Are they not all vaccinated?
So the Department of Justice and Public Safety also participate in the vaccinator test program, and I know I think the Justice and Public Safety Test or Vaccinate program, actually we've seen the number of people who were not vaccinated at the beginning of the program in September. The majority of them have been are now fully vaccinated and don't need to participate in the testing part of the program. And so that number is very small, but those Justice and Public Safety is across the board, so it wouldn't be just specific to the courthouse. And that number is very small across the whole system.
And how many of the close contacts of this case that are self-isolating are actual employees of the justice system? So how many justice system employees are actually away from work as a result of this?
I mean, we don't usually discuss all the details of a workplace, but there certainly were, at this point in time, again, it was early or late last night that we found out the information about this case, and I believe there are 7 staff.
Okay, thank you. And one other question, is there anything else that members of the public should do if they were in the courthouse yesterday?
No, it is not a public exposure site, and I think that was one of the first questions from Allison as well. It's not considered a public exposure site at this time. Certainly there's more testing of certain staff there that we identified earlier on, and it's so, but if that changes, certainly we would let everyone know. But it is, and this is what happens in lots of workplaces as well. We would do testing of certain staff, identify where someone was working, what they were doing, if they were close to other people, if they had their masks on, all of those, a range of those things. So but I think it was important. I think that release was issued by Justice and Public Safety this morning for obvious reasons that they wanted to make sure because of scheduling and operationally, they needed to advise changes there.
Okay, my phone line, it keeps going in and out here and I can't hear, so if you're finished answering the question, thank you very much.
You're welcome. I think they had the same issue happen last week, so I'm not sure. I think they're trying to work on it. I'm sorry, Brian. You sound clear to me, if that's helpful.
Okay, thank you.
Samantha, is that everybody? Okay, that's great. Anyway, thank you very much.